To start the defibrillator, press the green on-off button and follow the HeartStart FRx's voice instructions.
Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
CPR should continue to be performed according to standard protocol.